Good morning. My name is Eli Guevara, and I'm going to be telling you a little bit about cystic fibrosis. So we should begin with what cystic fibrosis actually is. Now, cystic fibrosis is a rare hereditary disease that affects the lungs and digestive system that is caused by a mutation in the cystic fibrosis transmembrane conductance regulator gene. Now, this gene has a mutation that causes a thickening of mucus which leads to an array of issues within the body. To get an idea of what cystic fibrosis actually looks like, you can look at this diagram right here to see what a pair of healthy lungs looks like when it isn't obstructed by excess mucus, and then a pair of lungs that is affected by cystic fibrosis, which has a giant amount of mucus buildup. This buildup is very dangerous as it can lead to chronic infections because bacteria sticks to it more easily. Some symptoms of cystic fibrosis include chronic coughing, chronic lung infection, like we just spoke about, wheezing or shortness of breath, bulky stool with difficult bowel movement, salty skin, male infertility, or even clubbed fingers, which is essentially an enlargement of the thumbs and fingers to make them look more square and club-shaped. Now that we've discussed what cystic fibrosis is and some of the symptoms associated with it, let's go ahead and take a look at this diagram right here showing how CF is passed on. So in order for cystic fibrosis to be passed on, both parents must be carriers. But even if both parents are carriers, this doesn't guarantee a child will have cystic fibrosis. So as you see here, there's only about a 25% chance that a child will have cystic fibrosis if both parents are carriers. The other 75% is seen here, which one of the 4 children won't even be a carrier and will not have cystic fibrosis. Now, about 50% of the children will just be carriers instead, but will not have cystic fibrosis. Something worth mentioning about the chances of cystic fibrosis being passed on is that the chances will go up tremendously should one of the parents have cystic fibrosis. The odds actually jump up to 50-50, meaning 1 out of every 2 children will have it. Now, one of the symptoms is male infertility, but that doesn't mean that a male can't have children. They simply would need assistive methods. Let's go ahead and discuss how cystic fibrosis is diagnosed. As you can see here, the main methods for diagnosing cystic fibrosis is through something called a sweat test, genetic testing, and newborn screening. So even with a success rate of over 98%, false positives still occur, meaning that tests should be coupled with other tests to confirm a diagnosis. This means that no one test should be used on its own. This diagram shows what the sweat test is. An electrode is placed on the baby's skin and sweat is stimulated. That sweat is gathered and taken to a lab. They're looking for the chloride levels. If the chloride levels are greater than 60 millimoles per liter, this is a high indication of the baby having cystic fibrosis. If it's ranging from 29 to 59, more testing should be done. Other ways to help diagnose cystic fibrosis is general X-ray, where chest X-rays may be taken to see the difference between lungs after several years. This right here is an example. I'll go ahead and zoom in and show you the major difference between the lungs. As you can see, the patient started out with far less clogging, and many years later, I believe about 5 years later, you see that there's much clogging of the airways and lungs. When it comes to a cure for cystic fibrosis, there currently is none. Instead, what is done is an early and aggressive symptom management. So this means combating symptoms with medication and other sort of therapies early on. Through this, we can give patients a longer life with a greater quality of life. Through symptom management, we can go ahead and give some bullet points on how to manage life with cystic fibrosis. Exercise and a healthy diet should be utilized, as the exercise can go ahead and loosen mucus within the airway to make it easier to cough up. Ensuring that you're up to date on vaccinations is also a great way to ensure that you're living the best quality of life. Airway clearing is a therapy that can be done at cystic fibrosis clinics. There can also be surgeries to remove obstructions or transplant to get a whole new pair of lungs, something that's become more recent in times with the advances of modern medicine. There's also regular medication which can help thin mucus within the airways, gene therapy, and you should also be getting regular follow-ups, as monitoring cystic fibrosis is one of the best ways to combat it. Now that we've established that there's no cure for cystic fibrosis, and we've covered some of the ways that we can manage life with cystic fibrosis, I'd once again like to cover the danger of cystic fibrosis. So that thickening of mucus buildup makes it more likely for bacteria to get stuck to it, which leads to infections, which is one of the symptoms we covered earlier. But this thickened mucus also has a digestive impact, as it can cause an obstruction within organs and even enzymatic releasing glands. Now, if these glands don't release their enzymes, it can cause a lot of disruption within your body. Let's go ahead and discuss the prognosis of cystic fibrosis. So it used to be a child killer, unfortunately, because there was such a lack of understanding of what the disease exactly did or was. But now, thanks to all the research that's gone into it, we've been able to develop great airway clearing techniques. We have surgery procedures that can remove obstructions, and we can even go ahead and replace lungs when they become too clogged up through transplants. All these things have made the median age from about 5 or 6 to anywhere from the late 30s to early 40s. This is a drastic change, and it's a great change. Key takeaways that I'd love for you to leave with today are that you should first off diagnose cystic fibrosis as early as possible. The earlier the better. Once you do diagnose, treat symptoms aggressively. Once you're treating the symptoms, ensure that the patient is diligent taking their medications and doing regular check-ins. Have them stay as active as they can and monitor their health through a specialized cystic fibrosis clinic. Like I said earlier, monitoring is the best way to combat CF.